Good morning, everyone. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing, our weekly briefing for Tuesday, September the 21st. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Today we're providing an update on the COVID-19 pandemic in British Columbia. And with that, it's my honor to introduce Dr. Bonnie Henry.
Good morning and thank you. Today I would like to provide a few updates on the vaccine program and some of the issues that have come up around immunization, as well as some updates on our ongoing public health response to the pandemic. First, as many people know, the COVID-19 vaccines in Canada that were originally approved for emergency use to ensure we could get vaccines as quickly as possible. Well, as of last week, on the 16th, both the Pfizer and Moderna messenger RNA vaccines and the AstraZeneca vaccine have now been fully licensed for use in Canada. So that is technicality in many ways, but it is important to know that all of the important safety checks have been continued and that these vaccines have now checked all of the official compliance requirements for ongoing use in Canada. One of the challenges that comes with that is that the companies are now able to use their brand names rather than just as we've been referring to them by the company names or by the technical names. So the new brand names, as you may be hearing about now, are Comirnaty, Spikevax, and Vaxzevria. And as you can tell, these are not easy ones to pronounce. And so I think, like many people, we'll continue to call them by what we've known them now for at least a year, which is by the Pfizer and Moderna. But just so that people are aware that they're not new vaccines, these are just the new brand names by the different companies. One of the things that has come up as well more recently is concerns that people have had about receiving vaccination if you're planning to get pregnant or if you're pregnant or breastfeeding. As we know, COVID-19 doesn't discriminate, and sadly we are seeing hundreds of new cases every day, the majority of whom, as you know, are people who are not yet vaccinated. And these are young adults, parents, new mothers, elders, and seniors requiring hospitalizations and in some cases ICU care. And I know from the visits that I've made to healthcare facilities and our ICUs around the province that we have a number of young women pregnant who are in ICU right now who are not vaccinated. We have seen this happen particularly since May, once we started to see Delta transmitting more easily, and we've seen the tragic outcomes of that across the province. So I'd like to take a moment to specifically speak to the importance of vaccination in pregnancy, while breastfeeding, or if you're planning to get pregnant. We know that this is a particular concern. We want to take as much care as possible when we're pregnant, and I know there's a lot of questions that people have. So it is important to get that information, to understand both the safety profile, the concerns that we know about the vaccines, but also to understand the risk of COVID in pregnancy. I encourage people to go to the BC CDC website where there's some very specific information about the vaccines, about the data. And while it is true that the clinical trials did not include pregnant people, we also know a lot more about these vaccines and how safe and how they work in people who are pregnant, in breastfeeding people over the last year, where tens of thousands of pregnant and breastfeeding people have been immunized. First, I want to say unequivocally, it's been recommended by the Society of Obstetricians and Gynecologists here in Canada, by our National Advisory Committee on Immunization, and by similar groups around the world. All of the vaccines that are approved for use in Canada are not only safe, but recommended for people who are pregnant, people who are thinking of getting pregnant, and people who are breastfeeding. We are very fortunate in BC that we have one of Canada's leading experts here, Dr. Deborah Money, and Dr. Money is the lead researcher on a BC and Canadian study on COVID-19 in pregnancy, and has been, as part of that study, is looking at the use of vaccines in pregnancy. Her work to date is very reassuring, and this will be coming out and being published. We've seen some information already from Ontario that's part of this, but it has shown there is no increased risk of complications after being immunized to you or to your baby. There are no differences in miscarriage, preterm births, stillbirths, or birth defects, and international data supports this as well. Over 90,000 pregnant women have been vaccinated against COVID-19 in the United States, and a study very recently came out looking at outcomes, and no major side effects have been identified. And importantly, safety data shows that pregnant people have the same, mostly mild, side effects as everyone else, and there were no increased risks of pregnancy complications or neonatal outcomes when you're vaccinated. But we do know that there is an increased risk of severe illness requiring hospitalization or ICU care if you get COVID-19 when you're pregnant. Canadian data, including about 1,500 pregnant people here in British Columbia, and international data show that significantly worse levels of severe disease, especially now with the Delta variant that we're seeing, and higher rates of adverse infant outcomes, things like stillbirths and preterm births, or babies being born early. In fact, knowing this here in BC and across Canada, we prioritize people who are pregnant for early access to vaccines, knowing that this risk can be averted by protecting people through immunization. In other words, it is highly recommended that pregnant women get their vaccine as soon as possible. Preferably, if you're planning on getting pregnant, to have the vaccine before that. But at any stage during pregnancy, it is safe, and it is an important way to protect you and your baby. This is especially important if you're somebody who needs to work out in the community and has contact with other people, because right now we know that this virus is transmitting in communities across the province. The second thing I wanted to talk about around vaccines is I get a lot of questions about people who've had previous COVID infections and whether they need to be immunized. And there's been some studies and little pieces of studies that have looked at the immune response in people who have had COVID and compared that to the antibody response after vaccination. There's a study out of Israel. One of the things that I can say is over 175,000 people we know in British Columbia have had COVID-19, and many people wonder if they need to be vaccinated. And the short answer is yes. We have looked at these data from across Canada, from around the world. We've looked at the information around antibody levels. And one of the things that we know is that the antibody levels after infection can be very varied. Some people's immune response can be really overwhelmed by infection, even with a mild or moderate infection, but particularly if you're hospitalized. And you may not develop that long-term immunity that protects you from reinfection. As well, some people have a milder illness and they may not stimulate the whole part of their immune system. We've talked about this before, how there's what we call a humoral immunity, so those antibodies that are in your blood, but there's also the cell-mediated immunity, those memory cells, the B cells and T cells, and they're the ones that stand on guard and recognize if you're exposed to the virus again. Some mild infections can be fought off and not really stimulate that cell-mediated response. As well, the virus continues to evolve, and we see that with a number of other viruses like influenza, where it changes rapidly and it can evade your immune response, particularly if you were infected and had a milder infection with one of the strains that was circulating a year ago. It's inconsistent in how people respond and how their immune system responds to this virus. So while many people will have a high level of protection for a long period of time, we don't actually know what the correlate or how much antibody you need to have to protect you long term. With the vaccine, however, we do know. We know there's a measured amount of antigen. We know that it gives broader protection from the vaccine against different strains, even if they change or mutate. And we know now from the vaccine effectiveness studies that we've done, both here in BC, across Canada, and internationally, that we have a standard response that lasts for a long time from vaccine. And we know that memory cells are activated very effectively with these vaccines. We also know that some people who've recovered but have had long COVID symptoms actually find their symptoms get better after immunization. For a number of reasons, then, it is important, even if you've recovered from COVID-19, to receive a course of vaccination. It's recommended by our National Advisory Committee, and it's recommended by experts on immunology, and it is the best and most longer-lasting, durable, and wide-ranging protection that you can have, even as this virus is changing over time. Also want to move on to some of the other things we know are happening right now. Currently, we know that the Pfizer-BioNTech vaccine studies in younger children aged 6 to 11 years old. Their phase 3 studies, the phase 2-3 studies are being finished now, and we know that they're going to be submitting what we call the data package on how well they work and how safe they are to Health Canada within the next few weeks, and I think that's very good news. That gives us just one more tool to be able to protect younger children against this virus. And our immunization teams across the province are actively preparing to be able to offer this vaccine as if and when Health Canada approves it for use here in Canada and it becomes available. So we do know there may be some delays before the manufacturing process means that this vaccine will be available for children in BC, but we are preparing so that we're ready to offer it, and we have all the information that parents will need to make those decisions about whether their children should be immunized. And I think this will be really important, especially as we're into the school year again. I also want to talk about our ongoing pandemic management. While getting our vaccines are the most important tool that we have now to try and combat these rising cases that we're seeing, I also want to reassure everybody that the public health fundamentals of case management, contact tracing remain in place. Contact tracing is a pillar of our COVID response, and we will continue to be as we go through this wave as well. Every new case must continue to self-isolate. That is not changed here in BC, and every exposure is investigated. I will say that it has been challenging with rapidly increasing numbers in some of our more strained areas, particularly in the north, and there may be delays in finding people in some cases. But if you test positive for COVID, you must self-isolate. That's how you protect yourself, your family, those you're closest to, and make sure that you're not spreading it in the community. But our public health teams are working across the province. We're scaling up again to make sure that we have the ability to find every case and to identify particularly contacts who are in high-risk settings. So if you're in a communal living setting, if you're a healthcare worker, in a school, university settings, those are the risk settings that we are focusing on, and we will be following up. We know the risk of spread to and from someone who is immunized is much lower. So vaccinated contacts, and this is a change that we made once we had high immunization levels in the summer, vaccinated contacts no longer need to self-isolate, but they must continue to self-monitor and to isolate and get tested if any symptoms develop. So that is a change, and I know there's been some confusion about that recently. But cases, absolutely. If you're sick with COVID, if you test positive, you must self-isolate. If you're a contact of somebody in a low-risk setting and you've been vaccinated, you no longer have to self-isolate for that 14-day period, but you do need to monitor carefully and get tested. I'd also like to remind people, of course, that we all as we're moving into fall, we know that there's other viruses that are starting to cause respiratory illness, and we need to continue to use all of our layers of protection, including washing our hands, staying home, staying away from others if we're feeling unwell, making sure that we're wearing masks, especially in indoor crowded places, and making sure everybody who's vaccinated against COVID, who can be, is vaccinated. As you know, as we're moving into fall, schools have opened again, and I want to provide an update on school notifications. Initially, it was my understanding that there was a level of anxiety from the way that we had given broad school notifications last year. But we hear from parents across the province, I hear from educators, and our teams have recognized that parents do need an authoritative source to go to have an understanding of what's happening at their children's schools. So we've heard that, and I've asked our team to get together right now to make sure that we can notify schools in a timely, less intrusive, and more sustainable way, and that parents will have access to that information rapidly. And I hope to have that in place by the end of this week so that you can have an understanding of what is happening at your child's school. I do want to reassure you that, as I just talked about with case and contact management, if your child has COVID, if your child has been exposed to somebody with COVID in a school system, you will be notified. It does take time to follow up on each individual case, and that sometimes can be take longer than you expect, but you will be notified. And public health teams are prioritizing our schools because we know how important it is to make sure that children are safely in schools and able to have all of the learning experience in the school setting. I will also say that this year is different because we have so many of our school staff and students protected through vaccination, and encourage everybody who is able to continue to get protected through vaccination. So to conclude, I want to also thank the millions of people across our province who have been vaccinated, including those who, until more recently, weren't able to find the time or didn't make that effort. Your efforts do count, and it is making a difference, and it's incredibly important for us across this province as we are seeing this virus continue to spread, and we know that it means that people who have not yet been protected are ending up in our hospitals, and that's stretching our healthcare system. I also want to extend my gratitude to the hospitality center, the gyms, the fitness centers, the movie theaters, the symphony, the arts, who have all now started to use the vaccine card and to be able to get back to some of those incredibly important social, sports, and arts activities that we've so missed over the last year and a half. We are all now a little bit safer as a result. But we are in this storm together, and it continues, and we will get through it together by continuing to do what we have done in BC all along, by respecting and being kind to each other and being compassionate and staying safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by saying that I'll be addressing three topics today. One, the situation in Northern Health and the pressures on the healthcare system then and some of the actions that we are taking. Secondly, the impact of COVID-19 on surgeries, ICU, and hospital capacity in BC, providing some information on that. And finally, further to Dr. Henry's comments with respect to contact tracing, to the efforts to ensure our contact tracing capacity continues to meet the needs in all the regions of British Columbia. Before I address these 3 points, I'd like to address one more, so I guess that makes it 4. I want to acknowledge that we've heard from British Columbians whose name on their BC vaccine card did not match the name on their ID. We've worked over the last week to solve this. The BC vaccine card has been updated to ensure that the name that is displayed matches the name on your BC Services card or combined driver's license and BC Services card. If the name on your BC Service vaccine card currently does not match, you can go to gov.bc.ca/vaccine card for an updated vaccine card. If the name on your BC Services card is incorrect, please visit gov.bc.ca/updateid. Alternatively, you may contact Health Insurance BC toll-free at 1-800-663-7100. I would note that as of this morning, 2,987,031 people have got their vaccine card in BC. That's in the less than 2 weeks that it's been offered. I want to thank everyone in BC involved in it, all of the people working who monitor and watch and look at the vaccine card when they come into restaurants and other cultural facilities and other places in BC, and all the people in BC who have supported this program. Almost 3 million people is a very impressive result and demonstrates, I think, the desire of British Columbians to ensure that everyone is safe in our province. I want to say that more than 4 million people, 4,024,302 as of Sunday night, British Columbians have now received their first dose immunization of a COVID-19 vaccine. That's 86.8% of eligible people as of Sunday night. I want to acknowledge, as I've noted before, that this rise in vaccination rates has been led by people 18 to 24, 25 to 29. As of now, 89.1% of all those 18 to 24 across BC have been vaccinated, and 87.6%, again, above the provincial average of those 25 to 29 have been vaccinated. I want to say how impressed I am, because even on the weekend, even today, the largest number of new registrations have come from young people, and I am very, very both impressed and thankful for their effort and their leadership during this period of vaccination in the pandemic. 79.4% as of Sunday night were fully vaccinated, meaning they've received 2 doses of a COVID-19 vaccine. And while we're clearly making great progress with respect to vaccination in our province, when you think of that, we'll be down today to just over 13% of people unvaccinated. The reality of vaccination and the seriousness of the COVID-19 pandemic continues to face us. As you know, as of again, Sunday night, 156 people were in critical care in our province with COVID-19. 138 of those were unvaccinated, meaning that those people, the unvaccinated, are remarkably vulnerable right now to COVID-19 and its most serious effects. And while we're making progress, as I say, with vaccination across the province, some areas are, of course, lower than others. If we are at 87% of the 12-plus population in BC had their first dose and 79.4% their second dose, in the Northern Health Authority, those numbers are 75% of the 12-plus have received their first dose and only 65% their second dose. In the Northeast region, within the Northern Health Authority, there's also significant differences between areas. For example, the Community Health Services area in Kitimat is at 95% vaccinated. We have high vaccination rates in Nisga'a and Haida Gwaii, high vaccination rates in Prince Rupert and in Terrace. But and you can see in the numbers as well in those regions a lower level of COVID-19 infection. But in the Northeast, for example, just 61.2% of those eligible are vaccinated with their first dose. In the Northeast region of the Northern Health Authority, if you cut it into 3 regions, 61.2% of those eligible are vaccinated with their first dose, and 50.5% are fully vaccinated. And the consequences of these vaccination rates are clear. We see them in our hospital. They put our healthcare workers and our healthcare system to the test, and they, of course, lead to people getting sick who do not need to be sick. And I want to be clear, we treat everybody with the best healthcare in the world. Our outcomes in ICU are the best in the world. We are going to continue to do that. This is not a question of blaming people for being sick, but we need people to understand the critical importance of vaccination. The northern region, over the past last 7 days, is averaging 41 new cases per 100,000 population. That's more, and just compare that to other regions in BC. That's 19 in Interior Health, where we still see far too many cases, 11 in Fraser Health, 9 on Vancouver Island, and 7 in Vancouver Coastal Health. Northern Health also has more cases per 100,000 of the population than any other health authority, more total cases by a wide margin in the last 7 days. These exceptionally high case rates are translating into hospitalizations and putting significant pressure on ICU capacity and health workers. The North is being overstretched by COVID-19 and overstretched by the fact that we are not meeting, to the extent that we need to meet them, our vaccination goals in Northern Health. And this is not because, and let's be clear, a vast majority of people in Northern Health have been vaccinated, and the extraordinary efforts by public health to vaccinate it, and the support of mayors and MLAs, and I want to particularly acknowledge the support of the Liberal health critic and leader of the opposition, Shirley Bond, in these efforts, MLAs such as Diane Davies and Mike Bernier, MLAs such as Nathan Cullen and Jennifer Rice. There is a lot of commitment and a lot to be proud of, but we simply need to raise those levels. There are 3 active outbreaks as well in Northern Health, including the Fort St. John Hospital, the Site C project, and Jubilee Lodge. We've taken steps to manage and ensure that quality care is provided to patients in the North, and we'll need to take further steps in the weeks ahead. As you know, on September 7th, new restrictions came into effect in the region, including restrictions on personal gatherings and events. In addition, to recruit and retain the people we need in Northern Health, and this is a broader problem than COVID-19, we are investing immediately up to $6.38 million for programs and incentives to encourage more healthcare workers to discover the advantages of working and living in Northern Health. Our commitment to ensure people in the North get the COVID care they need have required us to make the difficult decision to transfer patients from the North to Vancouver Island and Metro Vancouver for critical care. So far, a total of 12 patients, 9 of which are COVID positive. We expect the pressure on critical care in the North will continue until vaccination rates go up and cases and hospitalizations go down. We need to reduce pressure on the North, and as such, we are adding additional capacity outside of the North so we can provide the care to the patients who need it. We've worked with Vancouver Coastal Health, Fraser Health, and Island Health to identify dedicated ICU capacity incremental to what we've done already for patients from the North. 10 beds in the Lower Mainland and 5 on the islands. 15 high acuity ICU or ICU beds. Clearly, this is less than ideal. It will be difficult for those patients and their families and their loved ones. But these are necessary steps to ensure people in the North have access to quality care and to support our healthcare workers in the North, in the region, to do that. And this is what's happened in BC since the beginning of the pandemic. I want to make this point, and it's an important one. Initially in the pandemic, the largest number of cases were in Vancouver Coastal Health. There was a period in the pandemic when we had significant cases in Fraser Health. There was a period, both in the summer of 2020, but particularly this past summer, when we saw very high case counts in Interior Health. And now we see them in Northern Health. In British Columbia, we support each other, we provide resources for each other, and we're going to continue to do that. The most important thing we can do now, all of us, is to get vaccinated. The steps we are taking manage the situation, but vaccination is a solution. Please get vaccinated and follow public health orders so we can turn this around. Looking more broadly across BC, as of yesterday, as we reported, 307 people are in hospital with COVID-19. 156 are in critical care, and the very significant share of those, 138, were unvaccinated. 5% of COVID-19 patients in ICU are fully vaccinated, and they represent 80% of the population. Prior to the pandemic, our emergency departments were busy. People need critical care for a range of serious health issues. And of course, we have been completing more and more surgeries in British Columbia, and we're very proud of what we've done. But the arrival of this fourth wave has required us to postpone surgeries and to put safety protocols in place in hospitals so staff are freed up to care for COVID-19 patients. And we have, as that's happened, as you remember, in phase 1 of the pandemic, it happened in wave 3 of the pandemic, and it's happening now. We fought through each wave of our BC pandemic. The normal demand was then returned. The fourth wave in particular is creating pressures. Some of these pressures we have highlighted before, such as the pressures on Royal Inland Hospital. I want to be clear on this point. We have the power to turn this around. We can reduce pressure on our hospitals and staff currently by a simple act, a decision of solidarity, an act of good citizenship, getting vaccinated. Our healthcare workers continue to deliver the very best care possible to every patient. But it's not simply a matter of continuing to ask them to do more. We cannot keep asking them to compensate for the devastating consequences created when people make the decision not to get vaccinated. The smartest, safest, and soundest decision right now is to get vaccinated, and I, of course, strongly encourage you to do so. Last week, I reported that as a result of increasing pressures from COVID-19, we had reduced non-urgent scheduled surgeries in several health authorities. This has continued to be the case from September 12th to September 18th, during which time the health authorities postponed 511 non-urgent scheduled surgeries. Every one of those surgeries is medically necessary. Every one of those surgeries will be done, but they've had to be delayed because of COVID-19 pressures on our hospital. That's 47 in Fraser Health, 176 in Interior Health, 167 in Northern Health, 87 in Vancouver Coastal Health, 34 in Vancouver Island Health. No surgeries were postponed in the Provincial Health Services Authority. So for the 2 weeks, from September 5th to September 18th, there have been 798 surgical postponements. I would note, and this is a part of the regular report as well, that from August 29th to September 4th, health authorities report 5,865 surgeries were completed, and that is and continues to be impressive output by our healthcare system under these circumstances. This is obviously not where we want to be during our BC pandemic. It's not where we needed to be. These pressures experienced by our hospitals right now were preventable and can still be reduced. It is essential those who have not been vaccinated and are eligible to be vaccinated make the decision we are all counting on them to make. Another priority of our COVID-19 response continues to be contact tracing, as Dr. Henry has reported. Contact tracing has always been a key part of our pandemic response, and that hasn't changed. The number of contact tracers and the capacity of the contact tracing system has been scaled up and down during the pandemic as needed. When we had well over 10,000 cases in April, there was obviously an enormous number of contact tracers working and people supporting them and tracing aids working in the system. That number was reduced when we dropped down below 1,000 active cases. We're now in the 5,000 to 6,000 range in terms of active cases as of yesterday, and we obviously need more. By health authority, those numbers are as follows. Our current total of contact tracers, 123 in the BC CDC. We expect to be adding 42 in this next short period. 100 in Vancouver Coastal Health. We'll be adding a further 53. 126 in Fraser Health. We'll be adding an additional 49 contact tracer aides there. In Interior Health, 130. And we will be adding 50 full-time FTEs and casual contact tracing supports there. In Northern Health, we have 60, and we are adding 3 there, but obviously a very significant impact on Northern Health right now means that the BC CDC resources are being applied overwhelmingly there. And on Vancouver Island, we currently have 56 contact tracers, and we will be adding 113 in the next short period. This is comparable to, in most places, except for the Metro Vancouver area, to the peak period, the staff at our peak period of contact tracing, which was in the spring. I want to thank everyone involved in that and encourage everyone to continue to support, and our decisions to increase that capacity over time have benefited British Columbia in our COVID-19 response, but they've also benefited individual students, individual patients, I should say, and individual people living with who have tested positive for COVID-19 in every part of BC. I want to thank everyone working in our healthcare system who work as contact tracers, vaccinators, in long-term care and assisted living, and particularly those in acute care right now, for their continued work in this challenging time to care for and protect us. And I continue to call on everyone to think of our healthcare workers, think of one another, and get vaccinated as soon as possible. We have done well in BC. We've done better than just about any jurisdiction in the world. We're down to 13.2% of people unvaccinated, but we simply have to continue to reduce those numbers. Because as you see, when you're fully vaccinated, your chances of ending up in hospital or in critical care are so dramatically lower than if you're unvaccinated. It is not a risk. Not getting vaccinated is simply a risk that you cannot take, and one that effectively people will be taking not just for themselves, but for the entire healthcare system.